Okay, let's talk about ACS growth stimulation. This is a technique or a procedure we perform after your FUE procedure to get more growth out of the hairs that we did transplant. Now, a lot of people, if you think about this fundamentally, these hairs are going to sleep right after your procedure. Around the 10-day mark to 1 month mark, they're all going to go into recession and you're not going to see any hairs there for some time. And then they're going to come back. But during this period of time, the body has decreased the blood flow to these hair follicles because their metabolic demands are really low. It only spent a couple days growing these blood vessels as we transplant the hair, so they didn't actually used to be there. And then the demand went away, so these blood vessels very easily kind of just die down. Now, when those hairs want to grow again, they will never grow thicker or stronger than the blood supply allows. And that blood supply just doesn't exist when these hairs begin to grow. And that's when we want to intervene and create an environment for these hairs to reach their full potential. And that's why we deploy ACS, our autologous conditioned serum. This is our non-surgical hair treatment that we use for non-surgical hair growth after a hair transplant to get maximal growth. Autologous conditioned serum is a wound healing therapy. If you remember, wound healing has a couple fundamental parts. Number one, you need to grow new blood vessels to help nourish that wound such that it will heal. Second, you need to have growth factors that cause hair and skin cells to replicate to close up the wound. So in ACS treatments, what we're doing is we're laying down growth factors for new blood vessels to grow. At the same time, we're boosting these hair follicles with growth factors, increasing their metabolism, making the demand more from the body to get these blood vessels formed as quickly as possible, so all the hairs and the surrounding hairs around it are supported during this growth phase. We've noticed increased density with this treatment, and typically we'll do 1 to 2 of these treatments depending on how long your growth phase is. As soon as we see growth, like the first follicle come through, we're going to want to start these treatments, and that treatment will last about 6 months. If your growth phase is longer than that period, we'll do a second treatment to encourage further growth.